briefly mentioned this translocation 1114 when we were talking about the overarching management. So translocation 1114 is a mutation or a translocation that's actually found in various B cell malignancies and plasma cell disorders. Specifically in AL amyloidosis, it's generally not considered to be a high risk characteristic in most of the B cell malignancies. However, we found that the presence of translocation 1114 in amyloidosis patients does not confer a favorable prognosis. In fact, the presence of T1114 versus its absence was associated with inferior hematologic event-free survival and overall survival. So again, looking on the graph, this blue lines on panel A and B indicates those patients who had translocation 1114 versus the yellow, which did not have translocation 1114. And you can see that the blue lines are below the yellow lines, indicating an inferior survival advantage compared to patients who don't have translocation 1114. The high-risk FISH aberrations of translocation 414, 1416, del17p, and gain of 1q21, which are typically considered to be high risk for patients with multiple myeloma, very interestingly, were not found to confer the same high risk to patients with AL amyloidosis. And those patients who were treated with bortezomib did not derive much benefit if they harbored translocation 1114. So this was quite an interesting finding that actually led to us thinking of targeting translocation 1114 by itself with the BCL2 inhibitor called Venetoclax. So Venetoclax was studied in relapsed refractory AL amyloidosis patients harboring translocation 1114. And a high-level takeaway is that panel C shows patients who only have translocation 1114, and you can see that 78% of patients had a favorable response in the VGPR or CR category, as compared to all patients, which included both translocation 1114 and non-translocation 1114, who only had 63% response. And panel B actually shows patients who did not have translocation 1114, in whom Venetoclax only had a 30% response. So you can see that in patients who had T1114, there's almost an 80% response, favorable response, which also translated into a progression-free survival advantage and an overall survival advantage, as is demonstrated here on the right panel on the right. So Venetoclax is now considered to be a potential treatment option for those patients who have relapsed after their first or more lines of treatment, and those that harbor this translocation of 1114. Beyond the standard of care and translocation 1114, Teclistimab is now also found to be a potential option, not just in translocation 1114, excuse my typo here, but single institution studies have, and the first panel is from the excellent work by Dr. Chakraborty and team from Columbia, and the second panel is actually from a multinational retrospective cohort series of 17 patients from our European colleagues who actually administered Teclistimab, which is an anti-BCMA T-cell engaging therapy, to patients who were relapsing after their previous therapy for amyloidosis. And they found that there's actually a favorable disease response, as shown by the swimmer plots, to Teclistimab. So Teclistimab is a potential treatment option for those with AL amyloidosis. In addition, as I mentioned before, there are also studies with chimeric antigen receptor T-cell therapy or CAR T-cell therapy, and also other bispecific antibodies happening. So overall, some take-home points for this patient primer on AL amyloidosis. So AL amyloidosis is a disease condition that involves a type of protein accumulation called immunoglobulin light chains. These abnormal proteins made by plasma cells unfortunately deposit in organs and may cause damage to the kidneys, heart, liver, skin, nerves, GI tract, etc. Early and deep hematological responses directly correlate to favorable disease outcomes and organ function reversal. The frontline treatment includes a combination of chemo and immunotherapy called Dara-Cyborg, and with or without autologous stem cell transplantation in those who are eligible, if they have a suboptimal response to Dara-Cyborg. More drugs are starting to show efficacy in the relapsed refractory AL amyloidosis space, including targeted treatments such as Venetoclax in translocation 1114, Teclistimab, CAR T-cell therapies, and other bispecific antibodies, etc. And for future directions, we have exciting clinical trials underway in trying to make the amyloid protein disappear using anti-amyloid immunotherapy called birtamimab and anselamimab in the hopes of reversing organ function. Thank you so much for listening. I hope this patient primer introduction to this very rare blood cancer called AL amyloidosis was helpful. My name is Sridevi Rajeeve, and it's wonderful to be here with Grace. Thank you so much.